Hi everyone, welcome and thank you for coming. I'm Riley Moser. I'm a nursing student at BYU, Idaho, and I'm currently taking a community health class. And what they've asked us to do is create a health teaching plan for our community that applies to the current times. And I thought, what better subject to teach on than the one thing that's plaguing us every single day. So I'm going to be talking today about coronavirus. I'm going to be providing you guys with some information and some possible safety precautions you can implement yourselves. Okay, what is coronavirus? Also known as COVID, as the CDC has formally named it. It is an illness caused by a virus that can be easily spread from person to person. It is a new strain of the pre-existing coronavirus. Coronavirus has been something that's been around for a long time, and like for an example, when I was working in clinicals in the pediatric ICU, one of our patients was diagnosed with coronavirus, and this was like right when this was all starting. And so I was like, whoa. And my nurse was like, don't freak out. It's the old one that's been around for a long time. It's not the new strain. So just a little story there. They believe it started in a live animal market somewhere in Asia, and they believe it started from bats. But they're not entirely sure on that. So how exactly is coronavirus spread? So its main way of spreading is through close contact with other individuals that might be infected with the virus. The CDC says that usually it's when you're within 6 feet of someone who is infected. You can also become infected through respiratory droplets, so like when you cough or when you sneeze, the stuff that comes out of your body that lingers in the air, if you come in contact with that, you could become infected. And also touching surfaces that infected people have also contaminated, and then touching your face and like letting the virus get into your body is another way that you can become infected. So the CDC has come out with some safety interventions that you can implement to help minimize your chance of obtaining the virus. They currently have no vaccine, so they just strongly encourage to avoid, as much as you can help it, avoid exposure to the virus. Another big thing is to just stay at home. Like I said previously, just try to avoid exposure to those who might be infected. They ask if you do go out in public that you need to wear a mask or something on your face or for some form of protection. And frequent hand washing is another big thing. And when you do hand washing, make sure you're vigorously scrubbing your hands with soap and water for at least 20 seconds to be most effective with that. Another suggestion they put out is to disinfect areas that are frequently touched, just to get rid of the possible chance that the virus was there. So like I said earlier, one of the biggest things you can do when you go out in public is to wear a mask. The most effective mask we have currently against COVID is the N95 mask. That prevents the virus from actually getting into your respiratory system. These other masks are just kind of a form of precaution and protection that they ask you to wear, but they're not as effective as the N95 masks that we have. So the CDC has also asked that we practice social distancing, and what that is staying at least 6 feet apart from other individuals, and to limit your in-person contact with other people as much as possible. So what that includes is just trying to do a lot of your shopping online, FaceTiming family, just trying to limit that exposure. So I have a video that kind of illustrates why social distancing is effective. Oh, it's working. Kind of like what that video illustrated. If we are the one match that steps out of the way, we've stopped the progression of the virus, possibly infecting hundreds of other people. Okay, good. So who is at risk of getting COVID-19? And the answer is everyone. No one is immune, but those that are especially at risk of obtaining it are the elderly and those with pre-existing medical conditions. So if you're going out in public, try to do your best to avoid those that are at higher particular risk. So what if you do end up getting the virus? What should you do? So the CDC says stay home, self-quarantine, don't come in contact with anyone else for at least 14 days. Avoid public places and any forms of transportation. There's currently no specific treatment for coronavirus, so they're just asking that you seek medical attention only if the symptoms are like critical or life-threatening. And just take all the necessary precautions you can to keep yourself and others safe. Here are some common signs and symptoms that you might show if you have obtained the virus. So fever and chills, a cough, shortness of breath, fatigue, body aches, headache, a new loss of taste or smell, a sore throat, congestion, nausea, vomiting, or diarrhea. And these aren't all of them, these are just the main ones that they've put out, the CDC has put out. So when should you seek medical treatment? They just ask that you seek medical treatment if your symptoms become to the point where you are unable to live effectively, I guess, when it comes critical and life-threatening. So if you have trouble breathing, feel like you have pressure in your chest, new onset confusion, inability to stay awake, just anything new in onset that could be life-threatening. So one question that I have seen frequently throughout social media and on Facebook pages is how is the COVID test performed? And I've seen a lot of people with anxiety about, I don't want to go get tested because I'm afraid of how they do it, or they're just unsure about how it is performed. And so I'm going to kind of go over that. So it's a nasal swab test, and it is pretty uncomfortable. I've given a couple of these during clinicals, not COVID tests, but just a viral test with the swab that they put. So what they do is they take it's like a super long Q-tip and they insert it all the way back into your nasal passage. And it's farther than just like using a normal Q-tip. You have to push it back pretty far, then you have to hold it. So it can cause some mild pain. It's mostly just uncomfortable. And so they'll hold it there, and then they use those secretions and they test that in the lab for corona. And that's all that you have to do. So do you guys have any questions on coronavirus or the testing? Yes.
How do you know if you're going to get tested or not?
You should go get tested if you have been in close contact with someone that has tested positive or you are showing signs and symptoms. That's when you should probably go get tested. Or if you're just afraid that you have been exposed, you probably could go get tested